The emergency room looks like complete chaos. People everywhere, staff running around, patients waiting for hours while others go straight back. But there's a precise system controlling everything, and understanding it changes how you see the ER forever. Let's start with why you're waiting while someone who arrived after you just got taken back. It's called triage, and it's not first come, first served. When you walk into the ER, a triage nurse assesses you within minutes. They're measuring vital signs, asking about symptoms, and assigning you a number from 1 to 5. Level 1 is life-threatening. You're dying right now. Level 2 is emergent. You could deteriorate rapidly. Level 3 is urgent. You need care soon. Level 4 is less urgent. Level 5 is non-urgent. Here's what that means in practice. You've been waiting 2 hours with a broken arm. It hurts, but you're stable. Someone walks in having a heart attack. They go straight back, and you keep waiting. Someone else arrives with stroke symptoms. They're taken immediately because there's a treatment window, and minutes matter. Your broken arm isn't going to kill you in the next hour. The heart attack and stroke will. That's not the ER being unfair. That's the ER saving lives. But here's what makes people angry. The guy who arrived after you with a cut on his hand went back before you did. Why? Because triage isn't just about severity. It's about resources. That cut might need 5 stitches and 15 minutes. Your broken arm needs X-rays, an orthopedic consult, possibly surgery. The ER is playing Tetris with beds, staff, and equipment. Sometimes quick cases get slotted in while they're waiting for resources to free up for complex cases. Now let's talk about why the ER feels chaotic. You're sitting in the waiting room, and it looks disorganized. People coming and going, nobody explaining anything, nurses disappearing into back areas. But behind those doors, there's a coordinated dance happening. The charge nurse is managing patient flow, deciding who goes where. The triage nurse is continuously assessing new arrivals and re-evaluating waiting patients. The ER doctors are seeing multiple patients simultaneously, ordering tests for one, suturing another, consulting specialists for a third. If you're finally understanding how the ER really works, hit subscribe. We're breaking down the systems that look like chaos but are actually saving lives. Here's what you don't see. The ER physician isn't ignoring you when they pop in for 2 minutes and disappear. They're managing 10 other patients. They ordered your labs and imaging. Now they're waiting for results while treating other people. When your results come back, they'll return. It feels like neglect, but it's efficiency. One doctor can't sit with you for an hour while test results process. Let's talk about why everything takes so long. You've been in a room for 3 hours, and it feels like nothing's happening. But here's what's actually occurring. Your blood was sent to the lab processing hundreds of samples. Your X-ray was taken, but the radiologist is reading dozens of images in order of priority. Your CT scan is scheduled, but there are trauma cases ahead of you. Your doctor ordered a specialist consult, but that specialist is in surgery. All of this is happening, but from your perspective, you're just waiting. Here's something that makes ER wait times worse: bed availability. The ER might be ready to admit you to the hospital, but there are no beds available upstairs. So you wait in the ER, sometimes for hours, occupying a bed that could be used for new emergencies. This creates a bottleneck. The ER can't take new patients from the waiting room because admitted patients are stuck in ER beds waiting for hospital beds. Now here's why the ER seems to ignore pain. You're in agony, asking for pain medication, and the nurse says the doctor needs to examine you first. This feels cruel, but there's a reason. Pain medication can mask symptoms. If you have appendicitis, Morphine before the exam might hide the abdominal tenderness that helps diagnose it. The ER needs accurate information before treating symptoms that might hide the diagnosis. But here's what's changed. Many ERs now practice pain management earlier because studies show it doesn't significantly interfere with diagnosis, and keeping patients in severe pain is inhumane. Let's talk about why ER staff seem desensitized. You're having the worst day of your life, terrified and in pain. The nurse asks routine questions in a monotone voice. But here's what you're not seeing. That nurse has worked 12 hours, dealt with 3 code blues, been verbally abused by patients, physically assaulted by a confused patient, and watched someone die. They've got 6 other patients right now. That professional detachment isn't coldness, it's survival. Here's something that drives ER staff crazy. People using the ER for non-emergencies. Someone comes in at 2 a.m. because they've had a cold for 3 days. Another person wants a pregnancy test. These cases clog the system. They're triaged as level 5, so they wait for hours, then complain about wait times. Meanwhile, actual emergencies are being delayed. But here's the complicated part. Sometimes what seems non-urgent is actually serious. That cold is pneumonia. That abdominal pain is appendicitis. ER staff can't dismiss anyone, so they have to evaluate everyone. Now let's talk about the physical layout creating apparent chaos. The ER has multiple zones you don't see. There's the resuscitation bay for the sickest patients. There's the fast track for minor injuries. There's the main ER for everything in between. There are psych rooms for mental health crises. There are isolation rooms for infectious diseases. Patients and staff are constantly moving between zones based on changing conditions. Here's what adds to the chaos. The ER is the hospital's front door. Everything that can't wait for an appointment ends up there. Chest pain at 3 a.m. ER. Fell and might have broken your hip? ER. Psychiatric crisis? ER. The ER isn't designed for all of this, but society has made it the catch-all for urgent medical needs. If this is changing your perspective on emergency care, make sure you're subscribed. We're revealing the truth behind the healthcare system's most misunderstood department. Let's talk about documentation, because it's why your doctor seems glued to a computer. Every decision, every medication, every test must be documented for medical records, billing, and legal protection. That doctor typing while you talk isn't ignoring you. They're recording your symptoms, medical history, exam findings, clinical reasoning, and treatment plan. If they don't document it, legally it didn't happen. Here's something about ER billing. The facility charges separately from the physician. You get a bill from the hospital for the ER visit, room, supplies, and tests. Then you get a separate bill from the ER physician group. Sometimes you get another bill from the radiologist. And if a specialist saw you, that's another bill. Patients think they're being scammed, but it's how ER billing works. Now here's why ERs can't turn anyone away. EMTALA, the Emergency Medical Treatment and Labor Act, requires ERs to screen and stabilize everyone regardless of ability to pay. If you walk into an ER, they must evaluate you. They can't ask about insurance first. They can't refuse care because you can't pay. This is why ERs treat everything from true emergencies to minor problems. Here's the dark side. Hospitals lose money on ER care constantly. Many patients can't pay. Insurance often underpays. But the ER keeps running because it's required by law. Let's talk about why the ER feels impersonal. You're not a name. You're the chest pain in room 5, or the ankle fracture in fast track. This sounds dehumanizing, but it's practical communication. When a code blue is called, saying code blue, room 7, is faster than names. When staff are managing 12 patients simultaneously, referring to chief complaints helps them prioritize. Here's what ER staff wish you understood. They're doing their best in a broken system. They didn't create the insurance problems, the hospital bed shortages, the lack of primary care access, or the mental health crisis that floods ERs. They show up every shift knowing they'll face verbal abuse, physical violence, impossible decisions, and heartbreaking cases. And they do it because when it matters, when you're truly sick, when you're scared, they'll fight to save your life. The ER looks chaotic because you're seeing one piece of a massive, complex operation. Multiple patients, multiple priorities, limited resources, unpredictable arrivals, and staff trying to make life or death decisions under pressure. It's not chaos. It's controlled crisis management happening every single day. Next time you're in the ER frustrated by the wait, the apparent disorganization, the impersonal care, remember there's a system running underneath that chaos. And that system, imperfect as it is designed to make sure that when you really need it, someone will be there to save your life.